Welcome to another episode of the Edmonds Moms Room Podcast. I'm Dr. Allison Felt, your host, and I am so grateful to be here with you today. Today we are talking all things fertility. I love this topic. I love this topic because for so many reasons. But when you want a baby, you want a freaking baby. Okay. And it is life consuming. It is altering in so many ways. When you want a baby and you get your period, it can be the most devastating thing that you experience, and you're literally mourning getting your period. You might be mourning your period even if there was like no chance you could be pregnant. Even if you didn't have sex, okay? Like, you could be mourning your period even if you weren't trying to get you pregnant. But the mere fact that you have baby fever or you're hoping to be pregnant is the fact that you're mourning your period, right? Like, when you want a baby, you want a baby. Now let's talk about, like, what if you didn't even have your period, right? What if, your cycle's been messed up? Maybe you got off birth control and your cycle just never regulated. Maybe your period hasn't come back and it's freaking you out and you're trying every single thing out there. You're reading everything on the internet to try and regulate and get your cycle back. It's devastating. Because then you start blaming yourself for, like, why was I on birth control? And, like, why did I do these things? Maybe you've tried every single diet out there. Maybe you've been to different endometriosis specialists, or you've, tried to see, hey, do I have PCOS? Like, you're just searching for any layer of hope when you want a baby. Like, there is just no denying that. And I think it's amazing that we have the technology now of IUI and IVF and, Clomid to increase ovulation and like all of these different things, right, to help us have healthy cycles. And, they say that our menstrual cycle is the fifth vital sign, right? Like, it is a sign of our health. It's actually comical that I am recording this episode today because I think I'm 15 days late. I have no reason why I'm late. I've taken 100 pregnancy tests. My husband has a vasectomy now, and even when he had that vasectomy, originally I was mourning my period because I was like, I'd still have a fourth kid, but it's his body and he was done having kids, and that's just what, I'm respecting that. It was a negotiation I made to get my third kid. But anyways, to TMI, right? Like, but that makes me start to like, I need to get a hormone panel done. My body's been through some stress recently, so there's absolutely that factor. I've been waking up way too early in the morning and not getting enough sleep, and that could be a factor. I was in a diet deficit for a long time. My nutrition is now up, my calories are now up, but maybe my body is just like reactively like, holy cow, what did you do to us? So there's all these different factors in menstrual cycles, and you can read about them online. I'm not going to dive into the actual cycle today. There's a ton of podcasts that do that, but I want to dive into some things that are in your control that you can start to do in order to help facilitate your menstrual cycle, to help facilitate your fertility, and improve your container for the conception experience, right? I think this episode is really cool to do, especially in line with our episode where I interviewed Jess McEwen, because she is the spirit baby whisperer, and whatever you believe, you might not be into that. You might think that is, I know some people that, have really strong religious believe that talking to spirits can lead to awakening the devil. And so I'm always very cautious on who I talk to about that, especially in the clinic. But on this podcast, I am open that I worked with Jess for the last 5 years. She's been a complete light in my life and has helped me bring in my third baby, and which is Jayla. She's helped me with the business. She is an intuitive. She honestly just connects you to your own power and your own intuition, and that's really cool. She talks a lot about and she talked about this in clinic when we had our last Women's Night workshop. She talks about your body has to be ready for the baby too. We have to heal. We can have blocks in our body, And I think I think it's really important to talk about this because oftentimes as we go through life as women, we are shut down, right? Like there are parts of us that like, yes, equal rights, equal everything. We are vibrant. We are this, we are that. And I hope you live in that society. But in the same vein, like sex is still shamed. Like your body is still shamed. Like you are taught not to like touch your genitals and like explore your own body. Like that's just the reality. So there can be a lot of shame around our bodies. There's also different traumas or experiences. I like I said in the previous episode, like I hate the word trauma, but it's like our bodies hold micro traumas, macro traumas. You could have something devastating happen in your life. You could just have little devastations happen in your life. We all have them. No one is free of them. This journey has them, and those can be stored in our bodies, and especially in our pelvic floors. So the pelvic floor, I'm going to dive into the container. Let's talk container. The container is your physical body, and you might have been doing some anti-inflammatory diet to improve your menstruation. You might be doing seed cycling to improve your menstruation. And those are all different aspects of working on the physical container. You might start to do energy work to work on more spiritual layers. You might start to do a lot of things in the medical realm as far as like IVF and IUI. Those are all, physical changes. But the reality is like true health is not just physical health, it's also spiritual health, it's also mental health, it's soul health, it's heart set, like how is your heart? And all of those parts of our health can have blocks in them. And maybe I'll dive into some of that, as this podcast goes on and evolves, and I definitely want to touch on all these factors of health because this is what creates total wellness, whether you want a baby or you don't want a baby. But I'm going to dive into the physical container healing and how working through the pelvic floor, working through the organs in the belly can absolutely change your fertility, can change your ability to conceive. And this is all really exciting stuff. And it's exciting because not a lot of people know about it. And it is also a sliver of hope, right? A sliver of hope that there is more that you can do to free your body to feel really good now. And when you can start to feel really good now, that's just going to improve your ability for a baby to enter your world and enter your body and grow. It's going to improve, the better your pelvic floor, the better your core. It's going to improve your ability to carry this baby, and it's going to improve your recovery postpartum. So you really can't go wrong. So I want to dive into what our fertility protocols look like. So if we have someone that's been going through IVF, IUI, it's been, it hasn't worked, quote unquote, right? They haven't conceived yet. A lot of times will be that change for them, will be that like addition to their program that they start doing. And they may or may not need IUI or IVF after that. Some of this is also related to what the partner sperm is doing, right? There is some research that is cool about manual soft tissue therapy, how it facilitates fertility in a wide array of adhesion related for infertility and biomechanical reproductive organ dysfunction. So what that essentially means is that like if we work on, and what we do with manual pelvic floor physical therapy is we use our regenerative technology to do this, is we restore normal visceral motility. What does that mean? It means that inside of our bodies, the organs have to move and shift, and that those organs are moving independent of you breathing. So even if you weren't breathing, obviously we're all breathing, right? But even if you're not breathing or you're holding your breath, your organs are still moving inside your body. They move. So if you have the middle of your body here, they move away from the midline and then they come back towards the midline, and all the organs move and rotate a little differently in your body, and sometimes they don't move. And so we have to help restore their movement and restore their function. Same thing with your ovaries and your fallopian tubes. Those things need to move in order to drop the eggs, in order to help the egg move along the fallopian tube, which then will meet with the sperm and then embed and implant into the uterus. And so That's all visceral motility. So we work on restoring normal visceral motility. There can be adhesions around those different organs. And so when there's an adhesion embedded in those organs, we help dissolve the adhesion as best we can. We help move the tissue around so it can move around that adhesion. Sometimes people have endometriosis. They don't know they have endometriosis because that's usually diagnosed with a laparoscopic surgery, and not all physicians that and not all OBGYNs are aware of, as skilled with endometriosis as others. And so a lot of times, even if you have an endometrial laparoscopic, exploration surgery, you might still have endometrial adhesions inside your pelvis. I listened to a doctor speak, and I cannot remember the name of that doctor, but I listened to her speak, this is probably like 2 years ago, and what she said is, she's like, endometriosis is rampant. More women than not have endometriosis, and she's like, one of the ways that if you feel anyone's cervix, so if intravaginally, if we insert a finger and we're palpating the cervix, if that cervix is deflected to the right, to the left, or if it's twisted, typically that means that an endometrial adhesion is pulling on that cervix. Now, I also believe that, there could be an imbalance in the sacrum, or there could be an imbalance in the musculature, or you walk heavier on one leg and that could be pulling on the cervix. But she was convinced, she's like, if you feel a cervix being in a different spot than midline, they probably have some endometrial adhesion pulling on that cervix. And I wish I could remember the name of this doctor. She was actually a genius and amazing with her descriptions of endometriosis. And so that was really interesting because so many of our clients don't have cervixes lying in their midline. They're usually deflected one way or another. So does that mean that everyone has endometriosis? I don't know. That's a discussion for another day. But the reality is we can help dissolve some of these adhesions that, and I don't want to say we can dissolve endometrial adhesions. We don't actually know that clinically, but we can feel that adhesions get smaller. We can feel that adhesions disintegrate and go away. And we can feel that if adhesion is really stuck in a tissue, we can get that tissue moving so that tissue can function much better. And we want those organs moving. We want blood flow coming to these tissues so that they can function better. And all of that is going to improve your ability to conceive, improve your ability to ovulate, improve your ability to menstruate. These are all really important factors. The other things are adhesions can be embedded within the pelvic floor. Now, and so these can all cause biomechanical, infertility. So, and so dissolving this can be absolutely essential. Now, there can be other reasons why you have infertility. It can be hormone related. It can be, so there's a lot of factors, but one of the most important physical factors of the container is A, do your organs move? And then B, can your pelvic floor move? And I'm going to stay on the organ level, then I will drop down to the pelvic floor level and we can talk through that a little bit more. The other really important factor in the fertility process is, and not even infertility, globally, generally, in your health and in your wellness, because anything you're doing for your fertility, you are doing for your health. You are just trying to optimize your container, right? Optimize also your spiritual and mental health, because we all need it, and clearing those blocks is going to help you with this pregnancy and bringing in this baby. But from a physical container perspective, we also need really good bowel movements. Really good bowel movements are an indicator of health. Constipation is not diagnosed until you don't have a bowel movement for 4 days. Any healthy person should be having a good bowel movement every day, right? We want to have a bowel movement every single day. When we can have a bowel movement every single day, what that does is it helps take pressure off of our pelvic organs. Our colon, our descending colon into our sigmoid colon, it's the very bottom of our colon, sits on top of our uterus and puts also pressure on the bladder. So usually you have your uterus and you'll have that sitting on top of the bladder, and then you'll have your rectum and on the back side. And the more that doesn't have backed up stool in it, the less pressure you're going to have on that uterus, the better it can function. So having a bowel movement every day is essential. Now that bowel movement is connected in tissue that's called fascia or peritoneum, if we want to be medical about it. And the more that you have peristalsis, which is the contraction of the colon pushing the poop along, the better it's going to move, the better you're going to have movement in that fascia. When you have movement in that fascia, the fascia that encompasses the organs of reproduction, which your uterus, your fallopian tubes, your ovaries, is called endopelvic fascia. Now, it's a separate fascia, but all of this is connected in the body. So the more the fascia moves around the colon, the more the fascia moves around the uterus and the reproductive organs. You can think of this as like a big sheet of saran wrapper paper, so like saran wrap. And when that's all connected and holding these organs, we need them to move really well in all places. So the better your bowel movements, the better your reproductive health, okay? So it is all connected. So if you aren't having a good bowel movement every single day, that's something to start to look at. That's something that needs to be improved to help improve the function of your organs. You can do this with different supplements. A lot of people will do magnesium. High levels of high-dose vitamin C and vitamin D have been shown to improve fertility in women, I believe, over 35 or 40. I don't have the research sitting in front of me, but you can go ahead and look that up. Let's see. Yeah, vitamin D and vitamin C decrease the conception time in women over 35, and that's from a Vitali et al. Study, and that was in 2017. And so that's just, something you can do. If you're high dosing vitamin C, you will, you'll definitely, you can take vitamin C to bowel tolerance. Now I'm going to caveat this. If you do conceive and you are pregnant, you want to not do high dose vitamin C, because that can increase uterine contractility, which can increase, we don't want to have any effects on pregnancy losses. And so the minute you think you have conceived, you would stop doing that high dose vitamin C, or if you are pregnant, you would stop doing that high dose vitamin C. So those are just some factors. That is why, I'm going to back it up, that is why you need your colon and your viscera moving so well, is so it has good function, it decreases the pressure on the reproductive organs, and that's all stuff that we can help you do. So when I'm talking about this, if you work with a pelvic floor physical therapist, they're going to work on your organs, not all of them, but anyone who is skilled at reproductive health and has, some grasp on fertility is gonna know that this is what needs to happen. It's a lot of hands-on work. So they can teach you how to move your own organs, and do work in that realm. But having it done for you is obviously gold standard. And I don't want to say obviously, but is absolutely gold standard. It kind of it feels like a massage. And the more that we can work through the abdomen, the more that we are just going to set you up for conceiving as best as we can, and get everything working for you. Now, next we are going to talk about pelvic floor health. So the pelvic floor is 3 layers of muscles. It also has nerves inside of it. It has lymph nodes inside of it. It has blood vessels and veins inside of it. And the pelvic floor is the connection of all of that tissue, and it holds the pelvic organs. It holds the bladder, it holds the cervix and the uterus, it holds the rectum. And much of the time, our pelvic floor, especially in women, is very tight and constricted. Now, it is meant to, have some tone to it, but we need to have an optimal length so that we can enjoy things like intercourse, so we can have good clitoral orgasms, so that we can have good bowel movements, so that we don't pee our pants, so our hips and our back don't have issues. The minute that these muscles start to get tight is the minute that we start to have dysfunction in the muscle. Because when that muscle is tight, a lot of times it doesn't just open up. It creates that new length of being a shortened tight muscle, which then restricts the blood flow. When we restrict the blood flow to the pelvic floor, we restrict the blood flow to the pelvic organs. those pelvic organs are needed for conception. So we need to get anything we can do to increase the blood flow to those pelvic organs. So working through the layers of the pelvic floor, all the layers of the pelvic floor, getting the nerves in the pelvic floor to move, getting the blood vessels to move, getting the tissue to stretch and open and create new length, because then it can actually contract more, believe it or not. Getting that to the pelvic floor is going to optimize the health of the pelvic floor and prepare for conception. So it's really cool because regardless, again, of even if you were trying to get pregnant, this technology, these things, this pelvic floor physical therapy and using regenerative technology that we have in the clinic, it all improves the blood flow. It improves the tone of the pelvic floor. It improves the visceral motility. And that is all going to not only set you up for a really good container for fertility, it's going to set you up for your general wellness. So even if you weren't going through the fertility process, this is how we want to function anyways. This is how we stay pain-free in our hips. This is what keeps us out of diapers in the nursing home. This is what keeps us out from surgery, getting our hips, our knees, our back done, right? So like all of these are extremely important factors in just general health and wellness. And it's also a big problem in our society because a lot of women don't actually have all of those things, right? A lot of them are peeing their pants anyways. I think if we just pull up a quick stat, this will be fun actually. Let's just pull up a stat. What we're gonna ask perplexity. How many women pee their pants? And we should actually say what's the incidence. And let's just see what they say. Oh, they say actually only 10% of women age 19 to 30, right, prime conception time, pee their pants. I was one of those people, by the way. It's one of the reasons I became a pelvic floor physical therapist. So it's actually just a great thing for me to know. I think this is completely underreported. I can pull where these stats are coming from. With age, 30% of women over 60 report incontinence, and that figure increases to 50% over 80. AKA their cores don't function. So this is just fascinating. These are this is from a .gov website. What is it? I'll tell you what it is so you can look it up too. Womenshealth.gov. What a cool little stat. I think it's completely underreported. I bet you that is way higher. Obviously, a lot of people don't, like there are that subset of people that don't pee their pants, but it's hard to maintain a healthy pelvic floor. The pelvic floor is also innervated by the nervous system, right? So that's why when we have stress or trauma, we hold that in our pelvic floors. So if we have stress and you feel like your neck is getting tight, your pelvic floor is getting tight. So we have parasympathetics stimulate the vagus nerve, or the vagus nerve stimulates the parasympathetics. The vagus nerve is responsible for relaxation. It's responsible for breathing. It goes to our diaphragm, and when we stimulate diaphragmatic breath with the vagus nerve, that's going to stimulate our parasympathetic system, helping us get to rest and digest, have really good bowel movements. If we are in a heightened state of arousal, modern day stress is not a tiger chasing us, but it might be checking an email and you're like, shoot, I have to respond to that, or I have to do this is my to-do list, I gotta get this done, then I gotta go to the grocery store, then I gotta go to the gym, then I gotta do this, right? Modern day stress, right? And I'm not saying one is worse than the other, but we still perceive that modern day stress. Our bodies physically still are in the state of the tiger is chasing us. And it's fascinating because if we are in that state, our pelvic floor is completely constricted. The more time you spend in that state, the harder it is for the pelvic floor to find a new resting length. So then it just gets tight. It becomes more like concrete. If you've heard me talk before, I talk about this all the time, but the more that muscle stays tight, the more it turns into beef jerky. It doesn't have blood flow and it dehydrates. The more blood flow we can bring to that muscle, the more elasticity and stretching and opening and eccentric lengthening and strength we can bring to that muscle, the better, the healthier that muscle is, the more it is like a juicy chicken breast or a steak versus beef jerky. So I just want you to keep that in mind, and that is our goal for conception. Now, the beautiful thing And that's our goal for general wellness, okay? So again, not one and the same, very much the same thing. The other like side note is if you have like painful intercourse or sex does not feel good, maybe initial penetration is burning, maybe deeper thrusting, it feels like your partner's hitting something, maybe certain positions are off limits for you because it just doesn't feel good, then that is a sign. You have some dysfunction in the pelvic floor. You need pelvic floor physical therapy, hands-on pelvic floor physical therapy. I specify hands-on pelvic floor physical therapy because there is no amount of exercises that are going to restore the quality of this muscle. You can't just do Kegels and stabilization exercises and different things that are all super good and powerful in the right place. That's not going to improve the quality, texture of the muscle. That's what we have to change when we're talking about fertility. So, and when we're talking about getting pain-free for intercourse and intimacy, when we're talking about being able to have a clitoral orgasm. Now, the clitoris is just made up, it's called the bulbal cavernosus and the bulbal cavernosus and the ischiocavernosus. And these muscles, they make up the tip of the clitoris, and they're just muscles. And if you aren't able to have a clitoral orgasm, a lot of the time it's because the clitoris these muscles are already so contracted that to stimulate them, to bring you into climax, they're already contracted. So they can't go from a resting state into a more contracted state. It just makes that harder to achieve that orgasm. And so a lot of ways that we start to stimulate and open up pelvic floor is to get our pelvic floor having more range of motion, so we can then achieve climax. Now, we can also use different regenerative tools to help restore the blood flow, help restore a normal function of these muscles, but that is where pelvic floor physical therapy is going to be so instrumental in changing the function of what's called the superficial pelvic floor muscles, because that will help you achieve that orgasm. Now, there are people that have like hyperorgasmia, I forget the clinical name of it, so forgive me, I'm just being honest, where they orgasm all the time. Now, they can't even work out at the gym because they feel like they're in a constant state of orgasm. And so that just means that their nerves are just overstimulated from the constant tension, whereas some people with constant tension majority can't actually achieve orgasm because of that constant tension. So us improving the length of the pelvic floor can make orgasm much more feasible, much more achievable. So that was a lot of information on this podcast, all about setting yourself up for your conception journey, for your fertility process. But this stuff is amazing. And in the clinic, we do a lot of work as far as hands-on manual physical therapy to help prepare the body for conception, optimizing the length of the pelvic floor, optimizing the blood flow of the pelvic floor, optimizing the bowel movements, optimizing the visceral motility and visceral function. So this is all important and is really unique. I would say that how we're using our regenerative tools and wellness in the clinic, we recently have added into our fertility protocols, and it has been game-changing. So it's just helping with the blood flow to visceral organs and reproductive organs, and that has been one of the coolest things that we've seen as a result of our regenerative tools outside of manual pelvic floor physical therapy. And how we use that is different for everybody, and it depends on your personal story and like what your cycle looks like, if you are menstruating, if you're not menstruating, if you have endometriosis, adenomyosis, PCOS, whatever that is for you. That's where your story, you can't just take this podcast and be like, oh, this is for everyone. Everyone has a story, and your story is super important and very individual to you. And that's why how we would navigate someone's plan if they decided to come see us at our Edmonds or Poulsbo location, how we navigate this is completely individualized. And I'm doing this podcast, and obviously this, people tune in globally around the world, but people do fly to our office in Edmonds to come for weeks where they do what's called an intensive. So they're in the office for 3 to 5 days, and they get, our fertility protocols for either 3 to 5 days and spend multiple hours a day in the clinic in order to help set themselves up for their conception journey. We do that at different phases through the cycle. So if you're familiar, which you probably are if you found this podcast, but the menstrual cycle is day 1, right, where you start your menstruation, you get your period. Then we have our follicular cycle, which then, starts right after menstruation ends. So whether that's day 4 or day 7, and that usually lasts 11 days-ish. Then everyone's different. So like you might ovulate on day 6, right? Like it's just, everyone is different. So it's good to know. So in our follicular phase, we have FSH and rising estrogen levels. Then we have ovulation due to rising estrogen that releases the luteinizing hormone. That ovary then releases a mature egg. The only time during this phase that pregnancy can happen is during that ovulation time. And again, everyone ovulates differently. It can be day 14, it can be day 24. It depends. A lot of times you'll see a thicker discharge. Some people feel like they have an egg white mucus to their ovulation. Some people can feel their sex drive improve. You just want to, and then sometimes people will, take their temperature and then see the temperature increase. So then we have our luteal phase, and that can last 11 to 17 days. Average is 14 days unless fertilization has occurred. So those are the 4 phases. We have menstrual cycle, follicular phase, we have ovulation, and luteal phase. And so it's just important to know those phases. And if you are hoping to be pregnant, you can test ovulation, of course, and you might want to get in touch with your menstrual cycle if you are currently menstruating, and take that as a good sign. And if you're not currently menstruating, keep working to find out how you can start menstruating. And if you haven't considered pelvic floor physical therapy with our regenerative technology, you absolutely should. You can also work with, you can go any medical route, right? There's acupuncturists, there's herbalists, there's nutritionists. There is about any kind of specialist you want for fertility. And I just hope that you will consider using pelvic floor physical therapy along with our regenerative technology in order to help you improve your container for your fertility journey. So I'm Dr. Allison Felt. I wish you the best of luck on this journey. And if you're not on a fertility journey, but you're on a wellness journey, I hope that your cycle is regular for you. Maybe you're like me and you're like, something's going on and we're having an irregular cycle. Pelvic floor physical therapy is an amazing option to help regulate the cycle, but it's also important that you check your hormones. I've been getting pelvic floor physical therapy twice a week and under a lot of stress, and my period is not regular. So, it's not a one size fits all. This is where it's like everyone's story is different. And you can, maybe I didn't ovulate this month and I'm not menstruating this month, and it'll come again next month. We will just have to wait and see. I've never been this late. Maybe I'm perimenopausal. The options are truly endless. And that's why I'm telling you there's no quick answer. And I hope that you find me being super transparent with this. Pelvic floor physical therapy and regenerative wellness can absolutely be a part of your fertility journey. It's not the end all be all if it's not for you, but you can't go wrong, because this should be a part of everyone's wellness journey. In a perfect world, if we did everything we could to invest in our health and wellness, pelvic floor physical therapy, manual pelvic floor work would be an absolute part of it, because it is game-changing for the core. It is game-changing for bowel health and bowel function, and it's game-changing for reproductive function. So I hope you found this helpful. I'm Dr. Allison Felt. Thanks for being here.